And welcome back to the channel. Sorry about the headset. My mic was having issues, so this is just better. Today we're going to be talking about the male prostate, its primary function, the things that can go wrong with it, as well as ways to treat it and how to find it. Now, your prostate is about walnut size. It is located between your bladder and your urethra. Its primary function is when you're urinating, it pushes your urine through from your bladder to your urethra. Secondly, when you have semen coming from your testicles to your urethra, it secretes fluid which allows the semen to flow through more freely when that does happen. Now, some of the things that could go wrong with your prostate are prostatitis, and this is an inflammation of the prostate which is typically due to infection. Now, this is something that can be treated using medication or antibiotics, things like penicillin that really kill infections. The second thing is BPH, or benign prostate. I know the word. Benign prostate. Give me a second. Hypertrophy. Sorry, guys. Now, this has to do with an enlarged prostate. This typically happens for almost every man over the age of 50. An enlarged prostate creates more tension and makes it more difficult for urine to flow as you urinate. This is something that's typically treated through medication. However, when things do get seriously wrong, sometimes surgery is recommended to get rid of the issue. Now, No Shave November and Movember are set aside to specifically focus on prostate cancer. Now, prostate cancer, this can make it so you have difficulty urinating. You can feel a burning sensation or painful sensation while ejaculating, and goes hand in hand with other erectile dysfunctions as well. Now, your prostate, when it comes to treating it, typically it'll be through surgery, radiation, or chemotherapy. It depends on what your doctor says if this is an issue for you, but sometimes because your prostate is so small, the tumors there are very small as well. So a lot of doctors will wait to operate until the tumors get big enough. So this is known as watchful waiting, and depending on what your doctor will say, may be recommended. Now, when they go to check for prostate cancer, it's not as easy as checking for testicular cancer, where you can use your fingers and check for lumps, because your prostate is internal. It can be accessed a few different ways. First and most common being a colonoscopy, where your doctor will insert their finger through your anus and they will check through your rectum to make sure that your prostate is healthy. The secondary way that you can check your prostate is through an ultrasound. After that, there is a way that they check your protein levels in your prostate. Your prostate holds a specific kind of protein, and if your levels are high, you're more likely to have prostate cancer. If they're low, you're not as likely to. The next way that it gets checked, a needle that is inserted into your prostate that takes some of the tissue there, and then the tissue can be examined. When you are in like your mid to late 20s and then on, it's always recommended to check your prostate for cancer or any cancer-like symptoms. So it's always encouraged, even though it's awkward, to get your colonoscopy and make sure that you're checking for it, so that they can make sure that it's healthy and they can give you recommendations on how to keep it healthy or things that you can do. This was just your short, simple, to the point summary on the prostate. I will have more videos later on this month that go into more detail. That's all I got for today, and I'll see you guys in the next one.